I have a question. If you screen someone and you find that they may have an abnormality in the lungs or brain, then is surgery recommended?
So if there's an abnormality in the lung, that can be embolized, and there's some debate as to what size that abnormality needs to be, whether it's 1 millimeter or 3 millimeters, and that can be discussed with the physician treating you. But yes, that should be embolized for several reasons. One is to prevent brain infection and also to prevent possible stroke. So those should be treated, and that's something that needs the test needs to be repeated every so many years in every patient with HHT. It is also considered important that if you have HHT or may have HHT, and either you have been treated for lung AVM or you have not been screened, that you should be taking prophylactic antibiotics before procedures like dental cleanings and other so-called contaminated or dirty procedures to prevent brain infection. In terms of brain abnormalities, again, I think that depends on location, size, but those are also treatable, yes.
Okay, thank you. We have a question from Stephanie in Philadelphia.
Okay.
Stephanie, are you there?
Yes.
Go ahead.
So we might have this in our family based on just nosebleeds and some family history. And I'm just wondering what tests do we need to have done, and can that be done by our local physicians, or do we have to go to a center?
Well, I think you need to talk to the physician who you're seeing and see what their level of knowledge of this disease is. Now, being in Philadelphia, you're fortunate to be in a city where there is an HHT Center of Excellence, and probably the best thing for most patients, if they're able to, is to go to a Center of Excellence, because they will have the number of physicians and the expertise where these tests and diagnoses can be made relatively rapidly. So I would say if you have the ability to get to the center, yes. If not, and many of the centers will work in concert with your local physician to help with the diagnostic process or the screening.
Okay, and how early do they suggest, like with children, that you start having them checked? Because you said they might not have nosebleeds until their teenage years.
Correct. In a child with a risk factor such as a family member, it's many people recommend an MRI scan shortly after birth. There are infants who do have strokes shortly after birth because of abnormal blood vessels in the brain. In terms of the lung complications in young children, they can be screened using something called pulse oximetry. It's a non-invasive test where something is put on your finger and the level of oxygen in your blood can be followed.
Okay. Thank you very much.